I had a video with a list of compounds, and I want to analyze one by one what I'm taking and what dose and how often and what's the reason of this, you know?
Yeah, but I think we should say as a disclaimer that anything and everything we talk about in this video is only an observation of what you're taking. Hi, I'm Mike, founder of Balance My Hormones, where we help men and women on their journey to optimal hormone balance. If you're new to the channel, please consider leaving comments and subscribing so you get future content. We're going to talk about your supplements, the supplements that you to improve your leanness. Now, we talked about your diet in the first section. Now we're going to talk about your the supplements.
The supplements are taken in two categories, two classes.
Okay.
The performance supplements for the gym and the health supplements, okay? To maintain health and good labs. So we have the all-time classic, performance supplement with the multivitamin stack, with the BCAAs pre-workout, with the glutamine post-workout, with the creatine monohydrate post-workout, with the liver or beef aminos between meals. And of course the protein blend, not just whey, but other also sources of proteins with different amino acid profiles. And also the collagen protein that I applied with every shake and with my coffee, because I want to keep my connective tissue good.
Well, what is this? I missed that. What supplement?
It's from the UK, from the Applied Nutrition. It's collagen protein, you know.
Oh, collagen protein. Okay, that helps your joints, you're saying. Okay.
Yeah, along with vitamin C and the growth hormone, it synthesizes more connective tissue.
And then those are your performance.
Now, about the health supplements, I'm taking with breakfast now the fat-soluble vitamins, 5,000 IUs of vitamin D3K2 liposomal spray.
Okay.
25,000 IUs of vitamin A tocopherol. 300 IUs. This is also for immunity grade. I never had COVID, 2 years now. 300 IUs of vitamin E tocopherol. I'm taking also 50 milligrams of zinc for immunity. 400 micrograms of selenium for thyroid and also for immunity because it's antioxidant, powerful antioxidant. 1 gram of vitamin C with every meal. Okay, for
why with every meal? What just so it absorbs better?
Because it's a water solid. You know, you diurate this, but I want to keep high my antiviral protection. You know, and also my joints, my connective tissue synthesis. So it's really important to take the vitamin C with the collagen, you know, to synthesize more collagen, you know, along with growth hormone. It's a perfect stack. And also it's good for the elasticity of the skin or the arteries. Okay, it keeps the upper respiratory free from viral infections, especially now, you know, the pandemic during the winter. Also, alpha lipoic acid, I'm taking this as which is a powerful antioxidant. I'm taking also the formulas I have synthesized, one for the liver, one for the lipids. Now, so for the liver, we have NAC and acetylcysteine, 1,200 milligrams. That's synthesized glutathione. Salimarinol milk thistle, 500 milligrams. Choline and inositol, there are lipotropic factors that are able to excrete, you know, the stored fat into the liver, you know, the non-alcoholic fatty liver disease. I'm injecting 600 milligrams of glutathione every morning into muscular. Yes. It's a little bit painful, but
every morning. And what does the glutathione help with? It's
liver detox. It's anti-cancerous. It favors immunity, you know. So it's the most powerful antioxidant. Actually, people with COVID into the ICU have depleted levels of glutathione in the liver. And also, N-acetylcysteine is a powerful antioxidant that synthesizes glutathione, but it's the most effective antioxidant of the lungs.
So NAC is the precursor to glutathione?
Yes. Because if you take glutathione orally, it is destroyed in the gastric, fluid.
Which is why you're doing the injections directly?
Yes. Also krill oil was the best form of omega-3. Krill oil, yes. Astaxanthin, phospholipids also I'm taking with every meal, 500 milligrams. TMG, trimethylglycine betaine, that keeps methylation okay, and it keeps homocysteine levels low. Now, homocysteine is a toxic compound that elevates and is linked to cardiovascular disease, with stroke, and with deep venous thrombosis.
Have you had elevated homocysteine levels before?
When I was using steroids, it was above 10. Now I want to keep it single digit. So homocysteine lowers by TMG, by cobalamin, and by folic acid, by folate.
Okay.
And actually, smokers have elevated homocysteine, and it's linked with clotting, coagulation issues. And occasionally I inject also 1 milligram of cobalamin per week, to keep homocysteine low, to keep, it's the vitamin of vitality.
Sure.
I know it's a lot, Michael, but I think it keeps me good, healthy, strong, and...
I mean, most doctors at the NHS, if they saw what you were taking, I think they would just lose it. They wouldn't know what to say. It's
the proof is the labs, Michael.
Of course. But there's a mentality out there, especially in the UK, and maybe in other countries as well, where you don't need to take all these things and you're wasting your money.
I have to tell you, when I was about to be operated last April in my back, I broke my disc.
Wow.
Now the cardiologist told me, "Are you taking any medication?" So I'm telling her all this list, and she panicked, she freaked out. Why are you taking all this? I said, for anti-aging, I'm doing replacement therapy. She had no idea what is replacement therapy. And I had to bring my brother-in-law, who's a cardiologist, to ensure her that my ECG and my ultrasound is good. So there's no need to worry about, Sure. I understand, yes, that they have no clue about this anti-aging management.
Well, I mean, we can also say, though, not everyone wants to go down that route. Not everyone, some men, even the ones on TRT, want to do the very basic and just get on with their life and not have all those interventions. And other men, they actually do it. I mean, I think I used to, people would say that I'm all about better living through chemistry. And in many ways, if you can improve the quality of your life, with certain medications, especially if you have a deficiency, and you can improve it with your vitamins and supplements if you're deficient, or to optimize. There's nothing wrong with it.
I'm not diabetic, but I'm taking metformin in order to avoid elevation of A1C and glycosylation. Do I have to go up to 6 to worry about? I want to stay at 5%.
Yeah. Well, there are also studies on metformin where people who were diabetic were outliving those who were non-diabetic, because the diabetics were taking metformin and the people who were non-diabetic were not. And it seems there's a slight increase in longevity on those who take metformin.
Yes, because it mimics the fasting condition. Fasting is linked to longevity, AMPK elevation, lowering of mTOR,
Yeah. I want to ask you... sorry. I was going to ask you about the two supplements that you do take that might... some papers have shown may increase the risk of prostate cancer, and that's vitamin A and vitamin E. What are your thoughts on...
Her talk believes that both of them are anti-cancerous,
Okay.
I've read the study about the vitamin E,
Yeah.
but her talk has the opposite opinion. I mean, it's really good for the immunity, the vitamin E. And now about the vitamin A, it's very powerful against acne, the retinoic acid.
Yeah.
It can accumulate, of course, in large doses, but more than that.
Okay. But I mean, do you do a multivitamin as well that covers some of these? I mean, are there certain...
I prefer to take it those vitamins separate,
Okay.
and instead of taking a multivitamin,
Okay.
So A, B, C, E, D. These are the top vitamins that I want to take it separate,
Okay. It's just that there are some in the research community, or some doctors would even say, some of supplements you're just wasting them, you're just weeing them out. That these particular vitamins I mentioned, the E and the A, but you've addressed that, those can have maybe detrimental effects in some people, but it sounds like there's other studies that say, or at least Dr. Hertog and some of his research says it might not be the case. So I think...
Hertog supports in cancer patients mega doses of vitamins. And some of them IV, intravenous. Like C, for instance, glutathione and C, but also oral, alpha lipoic acid, vitamin A, vitamin E. And vitamin D also is really important anti-inflammatory hormone.
Which one is?
D. Vitamin D.
Yeah.
Of course, it's above the recommended dose. But you have to know, but vitamin D and B12, you go by the blood. You just take your level. I want to have my levels of B12 over 1,000.
Yeah.
to keep homocysteine low, to keep vitality, energy. Now, vitamin D, seriously, during winter, above 50, no doubt about it, especially with COVID now.
You take a high amount of vitamin D, yeah, and I think that's been recognized. I mean, I think during COVID, in the UK government, I think we're handing out vitamin D to some patients. So it's yeah, that's necessary. And I think we talked about in the past vitamin D with K2 and magnesium together.
Yes, because it directs the calcium to the bone tissue instead of the endothelium.
So that's good. So it sounds like you've got quite the cocktail. Again, this is kind of a disclaimer that you should go talk to your doctor. Though sometimes it's like talking to the wall because most doctors don't have a clue about this sort of thing.
Well, doctors support medication. They don't support supplementation. Supplementation is something that auxiliary that helps. But it's not. It cannot substitute medications. But it can help in some circumstances. Not just diseases, but prevention also.
Of course. So one thing we should also say, though, is that if you are on, especially the B vitamins, especially biotin, for example, and you do a blood test for either thyroid or testosterone, and you're taking a good dose of biotin, people that want to grow better hair and nails, we tend to see an over-exaggeration of testosterone levels that may not reflect reality because it skews the analyzer at the labs. So high doses of biotin, and there's a warning, especially by the FDA at certain labs, as well as in the UK, if you've got a patient who may be deficient in testosterone, but for some reason they're taking biotin, or even a patient that's already on TRT, it may show up a higher level of testosterone and thyroid hormones than matched reality. So we always advise, if you are taking certain supplements for biotin, maybe to stop a week or so out before you do your blood tests. Okay, so is there anything else you want to talk about on the supplement side or your hormonal balancing side?
We cannot tolerate eating so many carbs. If we want to eat carbs, make them complex, make them starchy with fiber, skip the simple carbs, and the sweets, of course, the less fruits, certainly no juices. If you want to eat fruits, it's good with a cover. So control your insulin, and by eating fiber, by eating protein and good fats. That's why insulin resistance develops, also out of muscle wasting, visceral fat. That's why we need testosterone, lifting weights, and eating protein to burn the glucose out of muscles.
Well, you look great. Your progress has really paid off. Your perseverance. So, I mean, again, that works for you and many other people who do various, diets and exercise and try to lead a healthy lifestyle. And it's a good example that you lead as far as, trying to focus on physical fitness, well into your 50s. So thanks again for coming on another video with Balance with Hormones. It's Dr. George Tiliatos. And if anyone has their own experience with a certain diet regimen or any success they've had in losing weight, send us some comments of even before and after picture. We're happy to mention it on the channel. So thanks again for watching. If you like the channel, please press like and subscribe, and we look forward to seeing you next time. Thanks again.